introduce yourself and tell us a little bit about yourself.
Okie dokie. My name's Sophia Ballantine. I'm a sports therapist, newly qualified from Newcastle College. I studied sports therapy for about 3 years. I started off on a foundation course doing training and rehabilitation for sport. I then progressed on to my honours degree in sports therapy with Leeds Metropolitan University. For the 3 years I've been working in a sports injury clinic in the college, and I've also worked at Morpeth Rugby Club, helping on pitch side, first aid, and shadowing their physio that they have. I've found the last 3 years very interesting, and really working in the different environments and the different clinics and working with loads of different people with different skills in the industry has made me open my eyes to what I really want to do, and it is clinic based and it is multi-skill based and dimensional. I feel most enjoyable part of my job is probably talking to the clients, getting the feedback afterwards, and working through a whole treatment session over a few weeks and just seeing the look on their faces when they get the good results. Mainly I focus on massage, but I also have quite a keen interest in the benefits of stretching and benefits of kinesio taping and all the things to do with diet and nutrition, which can help lower stress levels, reduce tension and reduce the build-up of waste within the body. I quite like how things such as the spine, which I learnt about mainly in my last year, how the nerves and the systems can all interact with the rest of your body, and I feel it's such an interesting topic. I'm hoping to learn a lot more about it and hopefully go on to do another few qualifications a bit more specialised into that part of the industry. Happy days. Next question.
Brilliant. What was it that got you into sports therapy in the first place?
Sports therapy, brilliant. Well, when I was younger I was very sporty. I did a lot of gymnastics and rock climbing and to quite a high level, but unfortunately, as it does, injury knocked me back. And it was quite a chronic injury, so there wasn't really any bouncing back from it, which kind of at the time I was just in the mid of my teens. I was only deciding what I wanted to do with my life, and it kind of knocked me back and knocked me into reality a little when I realised, I'm not going to go flying to the stars doing all this and that. But after my injury, the person who helped me the most was my physio, and before really hurting myself that badly, I'd never even known of the industry of physiotherapy. I mean, when I was about 5 or 6, I wanted to be a doctor, but I think it's all built up after that, and now I feel that when I left high school, all I wanted to do was physiotherapy. I wanted to help people in my position and help them get back to training and help them succeed in their hobby or their sport, wherever they wanted to go. But after about a year's thinking about it, and I did some summer schools for physiotherapy. I went and did some student shadowing. I learned a lot more about the actual part of it and what it entails, and I realised it really wasn't as specific to what I was actually wanting to achieve and wanting to do. It wasn't so much sports or rehabilitation based as it was a lot of work in hospitals and a lot of work outside where my interest lied. So I kind of took a step back from all of that, decided, right, I'm going to have to find something else that I wanted to do. So I started doing some coaching courses, and that's when I got turned on to sports therapy, where I met a few sports masseuses and I met a few fitness trainers, and they really kind of told me all about it. I went away, did further research and realised this is exactly what I want to do. I want to be right in the field with the athletes, with the sports people, and I want to be able to help people directly. So I had a little look around, found a brilliant course by Leeds Metropolitan for training and rehab that went on to an honours in sports therapy, and thought there's nothing better. I'll go for that before the cut-off, before I get charged crazy student rates. I actually had a little bit of a worry when I went first to apply for my course, because the spaces were already all full, and I ended up having to write a really long email explaining to them why I would be perfect for this course and I wouldn't let them down, and begged them basically to give us a chance. Came out my first year with top grades in some subjects and mediocre in others, but definitely where I was supposed to be, and I definitely deserved to get onto the honours course. I did quite well in a lot of various subjects. I surprised myself. I was really quite clued in when it came to biomechanics, which was a bit of a shock because it seemed so confusing at the time. Anatomy and physiology just always interested me as a kid, and it still does nowadays. And I think even with my level 6 qualifications, looking into the nervous system and stuff, is still tweaking that as well.
And outside of your work, what interests and hobbies do you have?
Surprisingly enough, I still do a bit of gymnastics. Maybe only about once a week, once a fortnight when I can find the time. Just up at the Newcastle City Gymnastics. Hopefully if I can keep getting the training in, I might be able to go into the competitions next year and such. Other than that, I enjoy reading, just relaxing with my friends, just chilling out, enjoying life.
Excellent, having a good time. Okay, and last question. How do you feel you can help people at Shield Clinic?
Shield Clinic, brilliant. Good question. I think I've worked in these kind of environments before, found them really enjoyable, and I feel if you love what you do, if you're enjoying what you do, it reflects on other people, it reflects onto colleagues, reflects onto your patients and your clients, and just helps the atmosphere relax. I think because of my sports specific kind of viewpoint on a lot of things, and I'm constantly looking into other various techniques and journals and stuff like that. I feel like I could possibly bring a little bit more towards the clinic in terms of maybe some more specific specialised treatments towards certain clients who may have sports related ailments or may want to improve their performances through getting treatments, massage, or even exercise referrals and such. Happy days.
Brilliant, that's it. Thank you very much.
Great.